Can one drink permanently destroy your vision? Yes, and NEET PG loves asking this. A patient develops blurred vision, high anion gap metabolic acidosis, and has consumed illicit alcohol. Which metabolite is primarily responsible for toxicity? This is a very important toxicology question asked in NEET PG 2024. Before seeing the answer, let's see a bit about methanol poisoning. For the toxic metabolite, when methanol is consumed, it is first converted to formaldehyde with the help of alcohol dehydrogenase. Formaldehyde is 33 times more toxic than methanol, but it is present only in transient time and there is no accumulation in body. It is immediately converted to formic acid with the help of aldehyde dehydrogenase. Formic acid is 6 times more toxic than methanol, and there is high accumulation of formic acid in the body, which leads to the most toxicity. And to remember full methanol poisoning, I have a mnemonic. Mnemonic for the methanol poisoning is methanol again. M for metabolic acidosis, we see high anion gap metabolic acidosis. E for eyes, we see first blood vision, which will lead to snowfield vision, which is a pathognomic feature of methanol poisoning. Then it will lead to permanent blindness. T for the toxic metabolite formed as formic acid. H for history of illicit alcohol consumption. A for antidote. The antidote of methanol poisoning is fomepizole, which is a specific antidote, but in emergency cases, normal alcohol is the antidote for methanol poisoning. Sounds crazy, right? But it is true, because when ethanol is administered, the alcohol dehydrogenase in the body is diverted towards ethanol metabolism, so that the metabolism of ethanol decreases and the toxic metabolite accumulation also decreases. Need of hemodialysis in severe cases. O for increased osmolar gap, and L for leucovorin as a supportive therapy to decrease the already formed toxic metabolite in the body. So the answer for this question, the metabolite primarily responsible for toxicity is formic acid. And with this, a PYT 12 of Final Leap series comes to an end. Follow and comment notes for these notes on methanol poisoning.